Hi everybody, hope you're having a nice day. So I decided today to pop on and do a quick vitamin D video. The nice thing about having my own YouTube channel is that I'm able to not only populate it with topics that I feel are important to my patients, but I'm also able to do things at the spur of the moment, and that's why we're going to do vitamin D today, even though it wasn't going to be one of my topics for a while. So the reason is I have two patients today, and both of them came in with drastically low vitamin D levels, and I thought it would be a good idea to refresh my patients with how important vitamin D is. First of all, as I tell all of you, my patients, vitamin D is not a vitamin, in my opinion. It really should be defined as a hormone. I don't want to get into the definitions between a vitamin and a hormone. Let's just say that just like other hormones can become deficient, vitamin D is deficient in just about everybody, and the deficiency worsens with age. The problem is that the consequences of chronic vitamin D deficiency are extreme. We learned very early on during the COVID pandemic that the vast majority of patients who actually got very sick and died of COVID were severely vitamin D deficient. That's attributed to vitamin D being what I like to say is one of the most important bullets in the immune system's gun for defense. So people that were running around with already low vitamin D levels, when they got under attack from COVID, those bullets were then used up to try to protect them from that infection, and like anything else, they ran out. People that had high vitamin D levels, just like they have a much lower incidence of the flu, we've known that for years and years, had a much decreased incidence and severity of COVID. And if you just look statistically, COVID deaths and vitamin D were highly related, as were glutathione and COVID, and that's another antioxidant we'll talk about another time. So, vitamin D, it is a hormone. I like to use statistics to prove my points. I'm not a bench research scientist, but I am a physician that's been in practice for over 26 years. And I can tell you the statistics regarding vitamin D are some of the easiest for me to just rattle off. Typically, we would have the topic and then maybe a couple lines of things there's so much on vitamin D that I told AJ, my research assistant, just put vitamin D up there and I'll take it from there. The list go on and on. I'll tell you a few things. Number one, anybody that has low vitamin D is going to have more anxiety, more depression. It is a hormone. It's a building block of every brain hormone, including serotonin and other mood stimulating hormones. Number two, anybody with a lower vitamin D level is going to be at an increased statistical risk of most of the solid tumors, including prostate cancer, colon cancer, pancreatic cancer, breast cancer for sure. Anybody who has a low vitamin D level, especially women who are postmenopausal, will have bone demineralization at a much more rapid pace, especially if they're not taking vitamin D with vitamin K2. Heart disease statistics are extremely influenced by vitamin D levels. Everything from hypertension, both incidence as well as effective treatment, to cardiovascular disease, arteriosclerosis, even congestive heart failure, have been shown to be correlated with deficient vitamin D levels. I'm now going to pick up one of my multiple books on vitamin D, and just going to read down because I can't list in memory all these things. So just here are a couple of the things that have been statistically proven to worsen with low vitamin D levels, and some of them, which I'll point out, have actually been shown to be cured or remediated with high-dose vitamin D treatment or just keeping levels high. Some of these things include rheumatoid arthritis, psoriasis, celiac disease, thyroiditis, multiple sclerosis, psoriasis, lupus, all the autoimmune diseases, things like Crohn's disease, vasculitis, asthma, chronic fatigue syndrome, things that you may not have heard of, sarcoidosis, autoimmune diseases, inflammatory diseases like Lou Gehrig's disease, multiple sclerosis, highly associated with low vitamin D levels. Increased infections, weak immune system, highly associated with vitamin D deficiency. Again, the list goes on. We talk about this every time someone's in my office. The fact that some physicians do not check vitamin D levels, to me, is, I'm not really sure what to say. Anybody who's not getting a vitamin D level check should certainly get one. I say to every one of my patients to tell their family members who are not my patients, just because it's easy to say so, that a woman who's not on vitamin D in this country at a certain level is going to be at an increased risk for breast cancer, for ovarian cancer, statistics. A man not on vitamin D to a certain level is going to be at more risk of prostate cancer. Men and women will be at an increased risk of other cancers together as well. And the list goes on. So it's a hormone. It's something that you will not get enough of through sun exposure. Sun exposure, first of all, to that degree would be dangerous to try to build up those levels. Ironically, people that take cholesterol-lowering medications have a much harder time maintaining vitamin D levels, because the magic is that the cholesterol in your skin is what gets converted to vitamin D from the sun. So if you don't have any cholesterol in your body, you're not going to make vitamin D. Many men who start to treat themselves with high-dose vitamin D will have increased testosterone levels. So there's a lot of things. Anxiety is treated for it. I will say that you can take too much vitamin D. So one, if I am not your physician and you're listening to this video, I am not giving you medical advice. I'm asking you to talk to your doctor, get a vitamin D level check, and then go from there. If you're my patient, you have no doubt we will be talking about your vitamin D level. I like to keep the levels between, let's say, 50 and 70, and that's based on the statistics we're talking about. Some people require a little bit of a higher dose, some people a lower dose. So this is a topic that everyone should know about. That's why I felt like just getting on. I hope this helps, and look forward to you at the next video. Have a good day.